Good evening. Thank you for inviting me. I hope I can share some information which you find helpful. And I'm be focusing on treatment and rehabilitation. So I go over some information. What is lupus? Just want a short review on that this is chronic inflammatory disease affecting connective tissue. Actually could affect any organ in your body, and it very often develops in the woman during the childbearing years, and it's currently no cure for it, but it could be treated very well and alleviating the symptoms. Mainly is issue with joint stiffness, as you know, and pain, and most of all fatigue, which kind of is a vicious cycle. Once you have those, then it kind of decrease your activity and it make symptoms even worse. So it's very essential that you have specific program and with gentle progressive approach with exercises to make sure that you can conquer those problems. Sometimes it's very beneficial also to use heat to decrease those symptoms. What are our goals? To improve range of motion and reduce joint stiffness. Another one is to make sure that we strengthen the tendons and ligaments and muscles around the joints to stabilize it. Then we help to maintain the strong bones and prevent osteoporosis, which is also often combined with steroid use, and it might be induced by those drugs who are used to treat lupus. And also to improve cardiac health, because many people with lupus are having also cardiac issues. With exercises, you make sure you're not gaining too much weight, and by that issue you're not putting more strain on your joints. And lastly, also to improve the sleep patterns, which are often affected, mood and general outlook on life. By exercises is like free drug. You promote secretion of endorphins, which are natural substances in the body to make sure that which help you with mood and decreasing the stress. So that's the general part you could definitely benefit from. And since this is a very individualized approach to any patient with lupus, because they all very different and individual with their symptoms and what is affected, I would like to just go over a little bit about the three main types of exercises which we focus on. Those are the exercises called range of motion exercises, strengthening exercises, and endurance exercises. And it's a balance between them how we set up the program. So range of motion exercises that are just the general movements throughout the available, in all directions, which are available at each joint. And we can have two types, which is passive range of motion exercises and active range of motion. Usually when you have flare-ups, the main focus is passive range of motion exercises. What's important is no muscle contraction during that exercises. Is mostly done probably by someone else going through the motion and performing throughout the range. What it causes also, it produces synovial fluids in the joints, which lubricates it and makes it less stiff and less painful. We can progress those exercises to active range of motion exercises, and then you have muscle contraction, which is involved during that exercises, and you're doing actually motion yourself against gravity. It's just general movement through the range that would be, for example, called shoulder flexion, when in passive somebody would actually move your hand through the range. And then after you're able to handle that type of exercises, we would move on to the strength exercises. And the strength exercises help to increase muscle strength, and they, as I mentioned, stabilizing the joints. And there are also, again, two types. The lower level, which are called isometric, where you don't really have a movement, but by exerting the pressure, you are recruiting the muscle and you have muscle contraction. So example would be If you press against the wall like that, there is no movement, but around the joint there is recruitment of the muscle. It's just basic strengthening exercise. And then there is resistive exercise. Once you're able to tolerate that, it doesn't cause too much pain, we progress and we would do resistive exercises where we would use either TheraBand, weights, and then down the line we could use machines like upper body ergometer, which is kind of on bike. Maybe some of you had chance to use it. Then as we can move on farther, we can we recommend aerobic exercises. Those are the exercises where improve cardiovascular fitness and endurance, and they increase your stamina and able to let you work out longer. The best exercises, you know, are walking, water exercises, using stationary bike, and then as you progress with those, you kind of want to set up for yourself the schedule and use this as a part of your lifestyle. Maybe swimming, you know, incorporate you know, 2 or 3 times a week, or walking daily. Those are kind of lifestyle changes which would be recommended. And again, just stressing out that it has to be individualized and very specific to how patient responds to those exercises and how fatigued they become and how quickly they recuperate. So how to get started? Again, cooperation with the doctor and discussing the plan, and then you would be probably sent out for a physical therapy, occupational therapy evaluation. And when you come to physical therapy, for example, what would you expect? The therapist would ask you about your history, your type of medication, the dosage, your lifestyle, what is the most difficulty you have. It would assess your joints, again going through your range of motion, see how you can move passively, actively, how strong your muscles are, if it's general fatigue and pain you're coming from. If you're coming with specific problem that would be focused on that specific problem, maybe tendinitis or knee pain, that would be focused and geared towards that area specifically on top of it. Very often, if it's stiffness and pain, we would apply heat to joints. We would stretch, warm up, do range of motion exercises, and start strengthening exercises. Once you exercise for a while, you might have some soreness. Then it could be used cold pack to calm the muscle, not produce too much pain. And you have to think about adding aerobic exercises and appropriate recreational exercises. If you feel that it's too much pain and joint becomes red and inflamed, you would kind of back off and you know, give yourself rest. One of the indication would be if it's 2 hours after exercises you still feel pain, that would be something you might want to report and give feedback to your therapist, so this way they can adjust your treatment. Also, they would ask you, you know, what your goals are, because there are different expectations from patients. So we would be geared very much so having you in treatment on the goal and what you want to achieve, you know, what you have most difficulty with. That's we always try to meet the patient goals. Like I mentioned, there is some parts where when you have to kind of be aware where is too much. Like I mentioned, 2 hours after treatment, you have some pain, that would be something to report back, increased joint swelling, decreased range of motion, increased weakness, and unusual fatigue, that would be some symptoms which indicate that maybe you overdid it. Again, when you have flare-ups where the joints are swollen and painful, you don't want to load the exercises with a lot of strengthening or aerobic exercise. You kind of downgrade to range of motion and working with the symptom itself. Any symptoms like while you're exercising, when you would have some dizziness or short of a breath and all the chest pain, that would be also something you want to be aware of and be mindful of to decrease the activity. Dr. Green mentioned about myositis. This is inflammation in the muscle which causes the weakness. So you want to make sure that the part with therapy where it's important there is very balanced and controlled, so you don't actually do more harm by exercises. So that's why with those exercises you want to watch on this inflammation. If it's too much, they might cause the weakness and fatigue, and that would aggravate the condition. They did the research though to make sure that while you have those symptoms and which cause myositis, which down the line cause the weakness of the muscle, they've observed people having every day for 5 days 15 minutes routine stretching exercises and walking, and they found that doesn't worsen the disease symptoms. So there was no change though in the chemicals found in the blood from exercises, but this research are still to be more widely addressed because there is not enough research still done on that topic. Because of the stiffness and joint and pain, there is also something you have to think of, which is how to conserve your energy. We all have to go through the day with all those problems which lupus poses on the people. It's extremely difficult in many ways, psychologically, physically, and emotionally. You have to look at the way that you could prevent the fatigue and adjust your day and conserve your energy so you can go through all the activities you want to go through the day. It's very good to have a schedule to figure out how you're responding to exercises, what it aggravates it, how quickly after exercise you fatigue, for how long you fatigue, how intense those symptoms are, and take that in consideration and be kind of aware how you participate, observe your body and listen to your body. That will give you feedback to adjust the best way. Energy conservation activities is just alternating different activities certain way. For example, pacing the work, to divide the activity, give yourself breaks so you don't feel exhausted at that time. Also, it's important to ask some questions. When you analyze what you're doing throughout the day, what task could be eliminated? How I can do this task differently? Is it necessary? If anyone can help me with that? What would the worst thing would happen if I didn't do that task? And then you continue with the thought while you doing activity. You're avoiding rushing. You make sure that you know, give yourself enough time and resting period if you do strenuous activity. Plan your work and spread the heavy task throughout the day, and again, eliminate what you not necessarily need to do. Again, awareness of what you're doing throughout the day, because if you're standing for 5 minutes or more, maybe you can arrange it so you can sit. Set up your workplace the way that you could have everything within the reach, that you don't have to do trips back and forth. Simplify your area, simplify your environment where you live so you don't have clutter to omit. So everything is as efficient as possible. You could use some equipment. There are a lot of adaptive equipment which could be used in daily life, and there is a focus for occupational therapy. So if you referred to occupational therapy, they will help you with adjusting all those tasks and cooking, dressing, or any activity, even washing and all those daily activity. They would help you to analyze and to make it more efficient. And the good posture, this is really important to think, although it's very simple, by the fact that if you have bad posture and your head is forward, body works much harder. So if you erect and your head is kind of in line, it's much more efficient movement. The posture is the simplest way, and it's really just awareness of the body, how it's positioned. Again, just to review, when you work, you have to have proper working condition. You have to pay attention to a lot of stuff which just would help make sure that you're not getting tired. The room has to be ventilated because you need oxygen. You get tired more easily if it's hot. You need good lighting so you're not straining your eyes. You could use some music to relax you and wear comfortable clothes. Just general approach to make sure that you maximize the environment. Thank you.